Tori. How's it going?
It's going good.
Good. Well, let me pull this curtain here for some privacy. Get my hands cleansed over here. My name's Christy. I'm going to be doing your exam today. Nice to meet you.
Nice to meet you too.
So I see from your chart that you've had several ear infections when you were a little girl and then a couple recently over the past year. Is that correct?
Right.
Okay, so I'm going to take a look at your ears today, make sure that you don't have any active ear infections today. Then while we're kind of in that general region, I'm going to take a look at your nose and then your mouth as well.
Okay.
Sound good?
Yep.
Any questions about anything?
No.
Okay, you may hear me talking out loud about some things that you may not understand. I'm going to be telling my assistant, and she's going to be charting for me so I can look back later and have a good idea of our notes, okay?
Okay.
All right, so I'm going to start. All right, so I'm going to kind of feel your ears here, okay? Okay. Ears look flesh color, no swelling. They look symmetrical to me. I'm going to feel the mastoid process back here. No concerns with the mastoid process. All right, I'm going to get my otoscope and I'm going to take a look inside your ears, okay?
Okay.
Might be just a little bit of discomfort here. All right, a little bit of earwax, which is completely normal and healthy. We want to see that. Not seeing any swelling, foreign bodies, or any discharge on this side. The tympanic membrane looks ovoid, looks pearly gray, non-bulging, and cone of light is detected. I'm going to take a look at the other side here. Same exam description for the right side. All right, perfect. So I'm not seeing any signs of ear infection today, so the antibiotic that you took a couple months ago must have cleared that up. So now I'm just going to kind of take a look at your nose, okay?
Okay.
All right. I'm going to put on my gloves here. Actually, while we're still in the ears, let's go ahead and do the hearing test. That might work a little bit better.
That's good.
So I'm going to stand about 2 feet away from you, okay? I want you to take your right hand, cover your right ear for me, okay? And I'm going to whisper something to you, and I'd like you to repeat that back to me.
Okay.
Okay? You ready?
Mm-hmm. Roses are red.
Perfect. Let's try the other side here.
Violets are blue.
Perfect. Do you typically have any problems with hearing, like on a daily basis or anything like that?
No.
Okay. So if you were to have any problems, we do have an additional test that we can use using a tuning fork. It's called the Webster test and Rhine test. However, if you're not reporting any problems with hearing and you pass that little hearing test we just did, there's no need to do that today. Okay? All right, so now we can take a look at the nose. Any problems with your nose that you have any concerns about today?
Nope.
Okay, just gonna kind of take a look here. Nose looks symmetrical, flesh colored, no lesions there. Okay, just gonna kind of tap here. Any tenderness there?
No.
Okay, patient reports no tenderness in the frontal or maxillary sinuses. All right, perfect. All right, so now I'm gonna do a little smell test here in just a second.
Okay.
But first, I'm going to occlude one side of your nostril, and I'd like you to breathe normally out the other side.
Okay.
Okay? Okay. Okay. Right and left nostril are both patent. Okay, so this is a smell test. What I'm going to have you do is I'm going to put the smell kind of right around your nose, and I just want you to tell me what you smell.
Okay.
Okay? I'm going to have 2 different ones here. Okay? Ready?
I smell lavender.
Perfect. One more.
Cinnamon.
Perfect. All right, so you pass that. All right, and then lastly, for the nose, I'm just gonna kind of inspect. So I'm gonna start here on your right side. So I attach a nasal speculum. I'm just gonna kind of look inside the nose and tell you what I see, okay? Okay, so the lining is flesh colored. Drainage is clear. Not seeing any swelling. No foreign bodies. Okay. Take a look at the other side here. exam description, but the septum does look a little bit deviated to your left side. Have you noticed any issues with that?
Mm-mm.
No? Okay. All right. So now I'm going to take a look at your throat. Let me throw my gloves away here. Any concerns with your throat today?
Nope.
Okay. All right, so I'm just going to have a pen light here, and then this is just a pen light. This isn't going to hurt or anything, okay? All right, so first I'm just going to inspect your lips. Patient's lips look pink, moist. I don't see any lesions on them. All right, go ahead and open up for me. Oral mucosa looks pink and moist. Hard and soft palate are also pink and moist, no lesions or ulcerations. Teeth are well kept and intact. No issues with salivary glands that I'm seeing. Okay, now I'm going to put the tongue blade on one side of your tongue. I'd like you to push with the opposite side. Okay?
Okay.
Go ahead and push for me. Perfect. Other side. Good. And then say ah for me. Patient has no tonsils. And if patient has good tone for the tongue. Any tenderness upon that exam?
No.
Okay, perfect. Well, you look great today. There is no reason to see it back unless you need something from us, okay? The only problem that I did see was that deviated septum. Now, it's not harmful. It's not going to be a nuisance to you unless you start to notice symptoms, okay? If you start to notice symptoms and they start to bother you, definitely call us and let us know, and then we'll refer you out, okay? Otherwise, I'll have my assistant put you in the computer as an as-needed basis, and then you can just call us anytime that you have any problems, okay?
Okay.
All right, perfect. Nice
Thank
to see
you.
you. Have a good day.
Me too.